In this episode, we have a very interesting guest. He is Dr. Vijay Bose. He has done 6,000 knee replacements. Congratulations on the 6,000 knee replacements that you have done. By the way, I have done 10,000 endoscopies. So don't tell him that. One of the most common problems is that youngsters have low back pain.
Only last few decades we are sitting here. The body is not made for that.
What is this ortho shoes? Is it only for people with symptom like pain or even for normal people can use this?
I wouldn't advise normal people.
Some research articles supporting some evidence to it, but there is no robust evidence at all.
Absolutely not.
Is it men or women having increased incidence of pain in the knees?
It's only the women. All across India, women seem to have.
How obesity is contributing to the joint pain?
So our knees will degenerate over time. But what we are interested in, why is it degenerating prematurely?
How do you use vitamin D and calcium in your practice?
Calcium, of course, we have to estimate the values always.
Before we dive in, can I be honest with you? It blows my mind that 57.9% of you who listen regularly still have not subscribed to our channel. If you enjoy the podcast, the stories, the science, maybe even laugh at our jokes, could you do us a small favor? Hit that subscribe button. It takes only 2 seconds and helps us keep bringing you better guests and episodes every week. I'm truly blessed to have all your support and I'm sure you will support me in the journey. Now, let's get into today's episode. Hello guys, this is Dr. Pal Manikam. Thank you so much for joining in another episode of our podcast series Gut Feeling with Dr. Pal. In this episode, we have a very interesting guest. He is Dr. Vijay Bose. My friend, he works in SIMS Hospital as an orthopedician. He's the most popular joint replacement surgeon here in Chennai. He has done 6,000 knee replacements. By the way, I have done 10,000 endoscopies. Okay, so don't tell him that. But we talked a lot in this podcast. Okay, so number one, we actually, if you're somebody who are looking for treatment options for osteoarthritis, if you have an aged parent who's dealing with knee pain, we talked about when to see a doctor, what is joint replacement, how to do that, what are the possible treatment options available. That was the highlight of the podcast. And the number second is that if you are looking to train your kid in a sport, we talked about sports injuries, how to lead a sustainable sports activity. We also had which best sport is recommended by the orthopedic surgeon as well. And lastly, we talked about how our alternative treatments, like let it be herbal treatments or, elastic bandages, we call it as puttur katte, all this. When should you use it? When should you not use it? Should you even go there or not? So it was a very insightful conversation. It was ending with building a patient-physician trust relationship back again. Why, as a doctors, we have lost the trust among patients. I had a wonderful time discussing with this. I'm sure you will have it as well. Let's dive deep into it. Hello, Dr. Bose. Thank you so much for being in the show. I'm very excited.
Thanks for having me, Dr. Pal. Really an honor and pleasure.
Oh, thank you, sir. Thank you. So you were in the UK before, huh?
That's right, yes. So after my undergraduate training here, I was in the UK for 6 years where I did my specialized training in orthopedics, and then I came back to Chennai in 2000 and so I've been practicing here for the last 25 years.
I see. How long you have been in SIMS Hospital?
The last 10 years. Yeah.
10 years.
Yes.
And you liked orthopedics right from the start?
That's right. So when I was doing my undergraduate in medical school, Madras Medical College, I got the gold medal for the orthopedic subject, and that was what got my interest into it, motivated to me, and then I've been in orthopedics ever since.
Nice. I hear that you are one of the best joint replacement surgeons. Let me ask you, how many knees have you replaced in your career?
So I've done about close to 6,000 knee replacements.
6,000?
Yeah.
6,000 knee
6,000 knee replacements. You'd be surprised to know that in India, the surgeons do one of the highest numbers of knee replacements. So very common in our population on osteoarthritis, and so we do large numbers. There are a lot of people in India who have done those numbers.
In your practice, is it men or women having increased incidence of osteoarthritis, like pain in the knees?
It's certainly the women.
Women.
I think that's all across India, women seem to have, but men, or maybe 3:1 would be the ratio that we do surgery on. So certainly more incidence in women for sure. But also men is also there.
Is there a reason behind that?
I think it's partly genetic. Like any other medical condition, there's a strong genetic component to it. And you'd be surprised to know that, people from certain parts of India, Andhra Pradesh, for example, Telugu people, very, very common. The Gujarati speaking people, very common. And Punjabis are very common.
For osteoarthritis?
That's correct, yes. So if you go to even Mumbai, you'll find the patients are all Gujaratis. And in Chennai, the patient will be Telugu speaking actually. That's the genetic predisposition they have. And in Delhi, they'll all be Punjabis. So it's very fascinating to see all that. But that's things. And then, of course, The diet and obesity and overweight, all that contributes, bad lifestyle contributes a lot to osteoarthritis for sure.
So based on your experience, people from Telangana, Hyderabad area,
That's correct.
and Punjab and Gujarat have an increased risk of osteoarthritis, pain in the knees.
Absolutely, yeah.
Now, could you think there's some genetic risk to it?
Must be, but how else do we explain that? Yeah.
How obesity is contributing to the joint pain?
Right. Okay. So as I mean, you know very well. So all the things that have a lifestyle component to it have a common origin. So they have, whether it is a derangement in the diet or exercise or they're not doing it. So they all contribute to this problem as well. So our knees will degenerate over time. But what we are interested in, why is it degenerating prematurely? So if we live for say 120 years, all our knee will be degenerate for sure. That is acceptable and that is normal. Nobody can avoid that. But what we are trying to address is how prematurely they're getting at 50 they're getting it, at 45 they're getting it. So that's what we want to, how to avoid that. That's the whole the concept.
So you were saying arthritis being developed at young age.
Absolutely, yeah. So we find the patient, even when I started practice in 25 years ago, our average patient was around 70 years. It became 65, 60. Now it's 55 actually, yeah. Shocking, yeah. So like diabetes or hypertension. So this is also coming down quite significantly. And we've done quite a few knee replacements for patients younger than 50 years old, actually. So it's very shocking. That's the lifestyle price that we're paying for our so-called modern lifestyle and the things that we have now, yeah.
And once you replace the knee, the recovery period?
So nowadays, like any technology, it's quite sleek and elegant. So we say roughly the same day the patient, morning we do the surgery, evening they start walking. And 2 days they have some physiotherapy climbing stairs. Third day they sent home. Usually they need a walking aid. The recovery period is about 3 to 4 weeks. And that period there's no need to be bedridden. There's no need for anybody to be looking after them. They can do their look after themselves. They can go to the bathroom. They can go to the dining table themselves. They can watch TV. But they cannot do any household work or cooking or etc. They can look after themselves first. But every day you'll find an improvement. And 3 to 4 weeks, usually they're okay to go outside, start household activities, start
with the walker?
That's for the first week. Usually with a stick. They don't need a walker. Most people will need a stick. And by 3 to 4 weeks, they're ready to get rid of the stick. That's the average period. So it's pretty quick these days, yes.
How do you use vitamin D and calcium in your practice?
That's a good one, yes. So calcium, of course, we think there's a deficiency. It's a dietary calcium is a deficiency. And we do estimate the values always before we give any supplementation. And then we
you check the blood work.
We use the blood work, yeah. Just blindly giving. The general concept in the public is that more of these supplements is good. And that's really, surprisingly among doctors as well. You'd be surprised, that in during the COVID epidemic, all doctors were taking vitamin C by the truckload, thinking that immunity will go up. Immunity, it's very important immunity, vitamin C, but only when you are vitamin C deficient. Once you cross that, it will cause serious problems like that, calcium as well. Now we know associated with cardiac disease, intestinal problems, kidneys, stones, all that with calcium. So overdose of what is intrinsically good is not good. Body is a delicate balance and we need to appreciate that. So vitamin D, again, a lot of misconception even among the orthopedic community we have. So the normal values, if you would see any lab work in any of the labs in Chennai, they will not give you a normal value because it's very controversial. There's only one thing in medicine that the labs will not tell you what the normal value is. Because it's controversial.
So vitamin D will not have a normal range.
That's what in the when you do a test, they will not indicate what is the normal range because they don't know because it's so controversial at this present point in time. The basis of that is this: the vitamin D is essential for bone and dental health, of course, that we know, but it's also a very important metabolic marker. That's what people don't know. Yeah, so up to levels of 30 is important for bone and dental health. So it's below 30, you need to supplement it to get to that. That's fine. But above 30 is very important for metabolic health. So whether cardiac health or whatever, it's vitamin D is. So now that's why vitamin D now is called as a hormone and not a vitamin because it impacts every organ system.
Correct. Okay, what is this ortho shoes? Have you heard of it?
Yes, yeah. So ortho shoes is a broad term that refers to various things that's supposed to be feet friendly. And the best form of ortho shoes is one that's made for you, custom made. So now we have even in facilities in Chennai, we have in our hospital as well, where your things are a computer is a model for you, and the insole is made for so that it supports you very well. Yeah, and then there are of course generic ones where it's made of very silicone rubber, very soft, and take care of your tender spots and etc. Things like that.
And is it only for people with symptom like pain, or even for normal people can use this?
I wouldn't advise normal people to
Normal people,
normal
okay.
people wear that. Yeah, it's only for symptoms that you need that.
Like foot
Otherwise,
pain or something
foot
like
pain,
that.
something like that. Otherwise,
It's very common in the US.
for everybody
For
to wear it.
everybody, it's very common. You go to a foot store, they have a 3D design machine. You place your foot on that machine,
Right.
it'll give you a 3D design, and then they will say that this is the exact shoe that you want. You'll be so happy. And the second you see, look at the price, you'll be so sad. it's a
I know the US is like that. I think. Yeah,
so
but
as a surgeon, you're telling me that only if you have pain, if you have symptoms,
as I said, the best is to walk barefoot. That is
Barefoot.
Barefoot, yeah. So
you are completely abolishing the business.
so if you do more and more of the footwear doing what you should be doing, then you will lose the ability. Use it or lose it. Yeah. So I would advise you to walk barefoot.
I see. Okay, so I have a interesting question for you. If at all you have I have my kid. He's 7 years old. Okay, and looks like he's very active in sports. Which is the best game to choose for kids for general fitness to prevent orthopedic injuries down the road? Okay, cricket versus tennis.
Certainly tennis, yeah.
Tennis. Okay. Tennis versus swimming.
Tennis.
Tennis versus basketball.
Both are equal, I would think.
Both
yeah,
are equal. If you want to choose one,
tennis probably.
tennis. Okay. Tennis versus soccer, football.
Tennis.
Tennis versus table tennis.
So let me tell you the reasons for why I choose tennis over all this. Yeah, that's so the
No. I'll ask you and then you.
Okay, right.
So tennis versus table tennis.
Tennis.
Tennis versus athletics.
Tennis.
Tennis versus badminton.
Equal. Yeah.
If you want to choose.
Tennis because outdoors.
Tennis. Oh my God! Tell me why tennis now. I want to play tennis now.
Yeah,
Tell me.
Incidentally, I play tennis, but nothing to do with that. Yeah.
No biased opinion.
No bias opinion. Yeah. So the first thing about swimming is that, of course, it is a very unidimensional, monochromatic we call it. It gives only cardio exercise. It doesn't give you the strength training that you need. And you need to have bursts of speed, like basketball, etc. If you do something like marathon running, without that doesn't. So an important component of the thing is your now we call plyo. Do jumps and things like that. So tennis gives you that sudden bursts of energy. So like a hit to an extent, like a hit to an extent. Then of course it gives you the aerobic component. So it gives you a good mixture of various things. Table tennis and it's a very you're no place to move. Only in this table you're playing. So tennis seems to be the overall, but other sports can be modified accordingly to do that. Yeah. Nowadays, for example, even a marathon people who are serious in running, they do cross training. That means they have to develop skills that is not specific for marathon running. For example, they'll go to the gym and do weight training. Why on earth would you do that? That's cross training because you don't want your body to lose out. You want to do cross. So every sport now has got cross training where things other than what you do should be incorporated into the program. So most sports physicians will know that now.
So I'll tell you a personal story. I was in Sacramento, California. I signed up for a gym. They said you can have 1 hour free tennis session, coaching session. So I went there. I played. At 15th minute, I sprained my ankle.
Gosh. So you lost 45 minutes.
Correct. I sprained my ankle. True story, okay? And then, we had that elastic bandage and then they shipped me to my home. This is a very common thing, right? Ankle sprain is a very common thing. Immediately after ankle sprain, you get this big swelling, right? When should we come and see a doctor? And in US, if I have to see an orthopedic doctor, by the time I see an orthopedic doctor, the swelling will be disappearing on its own.
Right.
Because it'll take 3 to 6 months.
Right. Okay. That's a very important question, I think, because this ankle sprains could be of different types. You all put under the umbrella term ankle sprain. Some of them could be just very minor sprain and it gets all right by itself. That's what. But many of them, especially if you have a lot of swelling, you need to go and see a doctor. Because, there's an important ligament called as the ATFL ligament on the outside of the ankle. So if that is injured, if you don't treat properly, then after 3-4 months, you'll get ankle instability. The ankle will be unstable. So at that time, if you put on a plaster cast for 6 months, it won't heal. So there's a very important concept that the healing potential of any tendon is only first 3 to 4 weeks. So a lot of people will come and say, for example, ankle injury, we examine and diagnose. It's got X-rays will be normal. That they got a ATFL injury, you need to put your plaster cast. They'll say, no, doctor, I don't want that and all. Then they go away. And then after 3 months, they'll come chronic ankle pain, instability. Now I'll have a cast even if you for 3 months. No point. You have missed the bus.
I see.
You have missed the bus, so that doesn't work.
In medical school, we have been taught RICE technique, right? So whenever there is a swelling in any joint, we say RICE, R-I-C-E.
Yes.
Rest the joint, R.
Ice.
I is ice it. C is compression. You do a bandage. And then E is elevation.
Yeah.
Can this be tried for injury?
This all supplements. It really work very good. So for minus pains, this would be the treatment. If we find that the ligaments are all okay, we come with a lot of swelling. Usually this doesn't have much swelling. A little bit of swelling is fine, but if you have significant swelling, you probably have busted a ligament. So you need to get proper treatment for that.
Okay. One of the most common problem that youngsters have is low back pain. In your practice, what do you think is the most common cause of low back pain in these young people?
But it's again postural, and again I think it's lifestyle again. So these days.
Let me ask you, what do you mean by lifestyle? Explain.
Right. Okay. So we're not taking care of our body. That's why
I mean, you're talking about like sitting and not moving. Is
That's
it
right. Yeah. So I'm very fond of saying this. You have a maintenance manual for your car. You have one for your maybe a computer as well, and we all know, and all our kids know how to look after their mobile phones very well. You must put this software, antivirus. But what about your body? It needs maintenance. But we think it will just take care of itself. It won't. So all diet, exercise, and all that. And then sitting for say this is the biggest problem that we see back pain. IT professionals, they sit for 10, 12 hours a day. So the body goes into what you call negative adaptation. So all the muscles and ligaments attach to your bad posture. We were not made to sit this way. And one of the things I think that people really, really realize is that we are all products of what the environment made by genetic evolution for us. Yeah. By evolutionary engineering. So whatever the natural circumstances, our body is made for that. So whether our fat storage we needed because we didn't have food all the time and all that. So we were never sitting. Only last few decades we are sitting. Yeah. So our body is not made for that. So it pays a price. Pays a serious price. So if you are going to be sitting for 10 hours a day, you need to do a lot of core strengthening exercises, spine strengthening exercises, neck strengthening exercise and all that. Because you are using the body, we are not meant to use it. Walking is a natural activity. Sitting is not a natural. Now, as we know, the sitting is the new smoking, as they say. So sitting like that. So they have back pain. So all these IT professionals come with back pain. All the time they come with back. And then if they don't take care of it early, then they have a disc disease and all sorts of things that they go into. So this lifestyle issue, again, flexibility, mobility, work on everything is very important. Diet, everything is so important for that.
So I'm going to show you some strange techniques that they've used on YouTube.
Okay.
And I really don't know whether this is true or not.
Okay.
This is in the chiropractor side.
Right.
In the US as well.
Very popular.
Very popular. So I'll show you this and you tell me whether this is okay or not. Okay. This is for back pain. Oh my God. Oh my God. What are all these?
Yeah, this type of alternative therapies, I don't know. In India, is very popular as well. At least in chiropractic, they go through a school, I think 4 or 5 years of training. So they know some techniques. But here it is done by anybody and can be very dangerous as well. And I've seen patients who have become paraplegic,
Oh my God.
quadriplegic after this.
I mean, they cannot move their legs.
They cannot move their legs. The whole paralysis occurs because so you've got to be very, very, very careful of that. This
After manipulating the neck?
They become completely, both their upper limbs and lower limbs don't move.
Because the neck has the nerve supplying for everything.
For everything, yes.
Everything.
Yeah.
So you're saying that a
Not a
person.
A person, yeah.
A person adjusted the neck.
And then they became, yes. I'm sure all doctors have seen that. Yeah. So that's not scientific. So you do without understanding the anatomy behind it, and then that's a big problem. So you got to be extremely careful with these sort of techniques. Yeah. But another interesting facet to that is why people in India, in Chennai or in elsewhere go to these things. That you got to ask yourself, introspect and ask why they go to that. So the modern medicine has failed them in some way, and that's the reason why would they go. So near our hospital we have this traditional bandage physician, they don't go to medical school, but it's so crowded. I can understand that,
You're talking about Puttur?
Very much.
Puttukattu?
Yes.
Ah.
That doesn't have any scientific basis. And the complication that we see is phenomenal. Say they have these tight bandages, so the blood supply to the legs and arm is occluded because it doesn't go. So we have to...
So wait. So, let's say we have a sprain. This happened with my Periyamma.
Okay.
She had a sprain.
Okay.
And then I said, go and see a doctor. And then she went to this Putturkattu place.
Okay.
And then they wrapped her around with multiple bandages. And then her pain got better. What is the complication out of it?
Wow, if you put tight bandages around a limb, then you'll find that you can actually prevent the blood supply, you can constrict the blood supply from going, the nerves also. And we have seen so many complications. We see on a daily basis, we see that. The people coming, they have lost use of their hands, they have lost use of the nerves. Because you constrict everything very tightly, there's going to be so everything cannot be treated with a bandage. Some injuries will heal by itself. And I guess they get their good name by do that. But what I find fascinating is why people go there in the first place. It's not scientific. We see complications like so many. It's not legally. I mean, nobody sues them or anything like that. And why people would go there. So we have to introspect, as physicians, that we have lost the confidence or the trust for them to go there. And near our hospital, we have it's so crowded. I always find.
Why so that place is so crowded than your hospital?
That's correct. Yes. I say, why would people go there? I mean, why would people go there? It's very fascinating why we have come to that state.
So I looked it up. Okay, there was some research article supporting some evidence to it, but there is no robust evidence at all.
Absolutely not. I mean, it doesn't have no scientific basis.
No
There's no X-rays. There's no MRI scans.
They don't take X-ray?
They do. They have a primitive X-ray. But how do you interpret those X-rays, define that X-rays, and whether it's intraarticular fracture, which needs surgery, which doesn't. I mean, we get training for 8-9 years to become an orthopedic surgeon, but how would they do that? So it's really, and you wouldn't. So I can understand somebody in a village who's not studied goes there. I can understand that. But very PhD people go there. You won't believe the celebrities,
is that right?
Big actors, big industrialists come in a very big high-end car, and that really surprises me as to why. That means we have failed them somewhere.
We failed them.
And that's why in our hospital, I work in Sims Hospital, where we make it a point that we should not treat the person who comes in as a customer, and that's like any other profession, and try to make money out of him. We have to first make him all right, whatever modality. Whether it is a non-operative means he needs non-operative, operative.
Maybe people think that, if I go to the hospital, they will extract a lot of money.
That's exactly the problem, because there are instances where hospitals do unnecessary tests. Rarely I've seen even unnecessary surgeries being done and things like that. And that's what we have lost the confidence. So we have to introspect and say, why would people, and then we need to. So in our hospital, we are very clear about that, So the focus must be the patient getting all right. The best way possible that you can. So money and everything must be there, of course. Today, you cannot ignore that. It must be there. But it must be in the correct way.
Correct.
We must ethical.
Anyways, it was a wonderful discussion. I'm going to wrap this up by saying, as an orthopedic surgeon, how do you take care of your fitness?
Well, as I said, the same applies. So I work on all 4 dimensions of exercise. I'm very strict on my diet.
I'm going to be very specific. How many times do you exercise per week?
So I tend to play tennis 3 to 4 times a week. That's the thing. And then I go to the gym after that. So that's my routine after that.
You have a good work-life balance, doctor.
And every day morning I do a flexibility and mobility routine. So within 10 minutes.
Like what, yoga?
Not specifically yoga. Parts of it are yoga. Then I do...
By yourself? Or any online?
Yeah, these days we can. No, not online. I learned it online, but calisthenics, for example. I do a lot of calisthenics.
You do calisthenics?
Yeah. I can do a lot of calisthenics posture and that. All you can learn. Today we can learn. That's the beauty of the...
So you learned it online?
Learned it online. Yeah. I learned what I need, I knew, because of the science behind it. And then you get better and better at it. I keep doing that.
Can you suggest an online course that I can take? It's okay. It's not paid.
Don't even take a course. Suppose you want to do some, whatever posture you want to do. You can YouTube use, and there's so many nice videos of how to do a posture, whatever you want to do.
Calisthenics is based on body weight.
Body weight, yeah. So you want to do how to do correctly a pull-up. How do you want to do correctly a pull-up? So you need minimal equipment at home, some bit of props, and then you can do that. And
so every day you move, looks like. Every day you move.
Yeah. So you want to do a crow pose, for example. You can see on the internet and you can do that. So every day we get better and better. And also we need to keep increasing our load. That's very important as well, isn't it? So the 4 principles of exercise is ORS, we call it. Yeah. So overload, adaptability, reversibility, and specificity. So these are
OARS.
OARS. So these 4 principles are very important. ORS. So whatever exercise you do, you must keep incremental load. Otherwise, so nothing is patient come and tell me that no, last 5 years I've been walking, 2 kilometers, doctor, I'm very fit. So I always tell them the first year it was very good for you. The second year was okay. Then probably didn't give you any benefit at all. You just think only psychological benefit it gave you. You need to keep. So all the signs of that exercise is very, very important. So
Beautiful, beautiful. Sounds good, super. I want to show the audience your book as well. Let me
Thank
just
you.
show you that. So guys, look at this. Here we have Universal Health Code. So I read the book. I think it is mainly for medical people.
Not necessarily, yeah. So today, a lot of the public is also very knowledgeable about this, and I think it's basically common knowledge. And as I was telling earlier, I was hoping somebody would write a user manual for the human body. Nobody wrote, so I I took it on myself to compile it. So I have to thank my classmates from my medical school, 84 Madras Medical College.
Madras Medical College,
Because,
prestigious, yes.
So there are gastroenterologists, there are cardiologists, neurologists, endocrinologists, all that got together, and then we crystallized. The problem today is there's so much of information that we cannot crystallize what is there. So suppose if I tell you is coffee good or bad, and you Google, then there are so many things coming up. And how
My
do you,
video is also coming up.
and how do you, and each one is contextual. So coffee can be good, coffee can be bad as well. So like that, every exercise can be, overdoing exercise can be bad as well. So everything is contextual. So how do you condense? So we decided to write this manual, and then this contains all aspects of, not one aspect. So everything is contextual and interrelated, yeah. So this would be the first ever maintenance manual written for the human body. So how do you take care of yourself? These are the facts. That it is not the encyclopedia. There may be much more information, but the starting point, okay, like a
Nice.
car. You have it, and then you develop on whatever aspect that you think is correct.
Nice.
Right.
Beautiful.
Videos are
Thank
there.
you. Thank you. Thank you so much. There's been a wonderful conversation. Thank you. I'm sure that people have learned a little bit about how to manage from an orthopedic standpoint. Keep doing the good work, and let's meet again when you are 12,000 knee replacements.
Thank you so much. Yeah. So let me comment on your beautiful work you are doing.
Thank you.
I think as doctors, we should impact the community, not only for the Chennai, for our city, our state, but we must heal the world as well. The world itself is getting very sick. Yeah. So you're doing a wonderful job. Yeah.
Thank you so much, Dr. Bose. Thanks a lot. Thank you.
Thank you very much.
That was a wonderful podcast. I learned a lot during the conversation. During this podcast series, I want you to actually jot down the points, because as you listen and you go on to the next video, you may not absorb into your subconscious mind. I want you to listen to the podcast, write it down, at least read it a couple of times so it registers on your mind, so that gets incorporated into your daily lifestyle activities. Let me know in the comment section what kind of changes that you may do after listening to this podcast, and also please let us know who are the other doctors that you want us to be in the podcast, so that you can get some medical information, very top quality. And that's why I do this podcast series. And we're also noticing that when you're watching the podcast, many people have not subscribed to the channel. If you consider subscribing to the channel, that will motivate us to give you even more top quality content. So please subscribe to the channel as well. And as usual, stay happy, stay gutsy. May God bless you.